The pandemic seems to be waning, but anxiety is still there. While infection rates are receding in some parts of Europe, the pandemic has many, especially young people, suffering from depression. What can be done? Welcome to DW's COVID-19 special. Also in the program, extreme quarantine in Taiwan. With her husband repeatedly forced to spend weeks in isolation, a new mother is alone with their baby. But first to South Africa. Even if they're willing, it's nearly impossible for many there to get vaccinated. Undocumented migrants or those without residence rights still can't get a jab.
Godfrey Chitanga from Zimbabwe has been living in South Africa for almost a decade as an undocumented migrant. That's also why he didn't want to reveal his name and asked us to use a pseudonym. Eking out a living as a freelance gardener in Johannesburg's leafy suburbs, life has been tough since the arrival of COVID-19.
I arrived in South Africa in 2013. I didn't have papers. I came to support my family. But things are difficult without papers now, especially if you want a COVID vaccination.
Godfrey Chitanga is one of an estimated 1.5 million undocumented foreign nationals in the country. All of them have struggled to access healthcare services since the pandemic began, and the government clamped down on services for migrants without the required paperwork. Fearing a massive segment of the population could be left unvaccinated, the University of Pretoria is now spearheading a mass, no-questions-asked vaccination program for them in the country's populous Gauteng province.
We're vaccinating people, mostly focusing on vaccinating undocumented people since they're struggling to get vaccinated. We're trying to get as much as people in South Africa to get vaccinated because it's important, and we're trying to defeat this coronavirus. So you can come to this place, you can get your jab, no questions asked. Whether you have a document or you don't have a document, you can come to us.
Living in South Africa with minimal enforceable rights and scant legal protections, the country's migrant community bore the brunt of the economic fallout brought on by the virus. Violent unrest swept through several parts of the country in July of 2021. Foreign-owned businesses and workers were looted and targeted by violent mobs. Nobuhle Verji of migrant rights organization Africa Diaspora Forum is worried last year's attacks could soon be repeated.
Being away from home is always difficult. So now it's even worse now that there is now the COVID-19 pandemic. You know, foreign nationals, especially undocumented ones, are the ones that are going through a lot right now. Some are not even getting vaccines simply because they're undocumented. Some have lost their source of livelihood. They've lost their jobs. You know, most companies have closed, most restaurants have closed. So there's a lot that is going on. And it's even worse now that they are being blamed for everything that is happening, you know, now. So now there's xenophobic attacks everywhere.
We received a complaint, Chief, about expired goods.
Though the violence has subsided, foreign nationals remain the target of frustrations for many in a country where the unemployment rate has now climbed to over 35%. South Africa's political parties are capitalizing on the growing discontent and calling for all foreign nationals to either leave or regularize their status. Some of these parties are now even conducting informal oversight visits to foreign-owned stores under the pretense of protecting their communities.
The Patriotic Alliance is very unapologetic pertaining to our stance with foreign nationals in our country, illegal foreign nationals. We are aware that tuck shops, corner shops are owned and operated by foreign nationals. So we're checking if they are compliant, if they're selling expired goods to our residents. It is our responsibility to take care of our communities, and that's what we're doing here today.
Godfrey Chitanga hopes things might become a bit easier as the economy begins to recover from the worst of the pandemic.
Things have gotten even more difficult since Corona arrived. There hasn't been much work, and I haven't been sending money back home to my family. But I'm happy now. At least I've gotten my COVID vaccination, which means I won't get very sick and be unable to work at all.
But with stubbornly high unemployment and economic growth remaining sluggish, his dream of living peacefully in South Africa and supporting his family back in Zimbabwe may still be a long way off.
In Taiwan, strict antivirus measures rule the lives of many families, often resulting in lengthy separation. People who travel internationally for work are forced to spend time in quarantine every time they return. That's especially hard on new parents.
Elsa Chang spends most of her time alone with her newborn because her husband is a pilot. He must quarantine for 5 days in a hotel and 9 days at home every time he lands, despite being fully vaccinated. All household responsibilities fall on Elsa's shoulders.
I'm practically a single mom because my husband is always absent. I'm always worried that if something urgent comes up, no one can give me a hand. It's also unfair to our son because he doesn't have bonding with his father.
Michael Wu's quarantine hotel is just 20 minutes away from home, but he can only communicate with his family by phone. In the past year, he has almost always been either up in the air flying long-haul flights or in isolation. He was absent from all his wife's pregnancy checkups before the birth of their son. Now he's missing out on the growth of his newborn.
I was confined for 190 days the past year. It's unbelievable that we've done nothing wrong, but we're treated like prisoners, just because we've been out of the country. The government thinks we're the dirtiest group and have to lock us up. Mentally, I've been down in the dumps.
During the early days of the pandemic, Taiwan was praised globally for its prompt decision to close borders and impose 14-day quarantines on all arrivals. That has kept cases down to less than 20,000 and deaths below 4 figures so far. But the self-ruled island may be a victim of its early success. As the world reopens, Taiwan struggles to exit the zero-COVID strategy, despite the 2-dose vaccination rate reaching 74%. Health experts say people in Taiwan have had a zero-COVID mentality for too long. There's a low tolerance in any outbreak. And with local elections looming at the end of this year, the government is seen to have little incentive to open up as public opinion continues to highlight the danger of the virus. With the zero-COVID mindset, every case is treated like a grave threat to public health and the disease carries a stigma. Elsa Chang said people with travel history, especially air crews, are labeled as potential infection control breaches.
Zero COVID is a dream. To achieve that, we have sacrificed a lot, including the well-being of us air crews. I hope the government will relax the rules soon.
But she might have to wait longer. The 3rd year into the pandemic, there's still no sign of border reopening or relaxation of COVID rules.
The Taiwanese government's pandemic restriction policy has been highly successful. The country has suffered far fewer infections and deaths than other nations. Around the world, over 5.8 million have already died of the virus, which remains a serious threat to many, especially those with pre-existing conditions.
A special FFP3 face mask. That is Lars Fischer's most important protection. The 43-year-old was born with an illness called Fraser syndrome and had a kidney transplant. COVID-19 poses an acute danger to his life. Every time he leaves the house, he takes a risk. I always have to be lucky. The virus only has to be lucky once. If I then think about the hospitals which are filling up, the fact that I can't be properly cared for, can't be visited, what if I get seriously ill? These are thoughts that go through my head. The coronavirus vaccinations are not having their full effect on him. Since his transplant, Lars Fischer has been taking immunosuppressive medication every day to prevent his body from rejecting the organ. After the first 2 vaccinations, I had very few antibodies, and only the ones that don't protect you. Now I've had 4 doses, and I'm still waiting for the results, but I'm afraid it still doesn't look very good. Lars Fischer knows that compared to many other people with disabilities, he has made it through the pandemic relatively well so far. This is also due to his profession. He is a science journalist with a focus on infectious diseases. He has been able to put his specialist knowledge about infectious diseases to good use over the last 2 years. It was also an incredibly exciting time for me professionally, because I was one of the very few journalists in Germany who really knew something about pandemics, and that was something that gave me strength, that ultimately also carried me along. Lars Fischer expects to get infected with COVID-19 at some point, but he hopes that by then, a drug will be available to treat him well.
Lars Fischer's life would be much safer if more people in Germany were vaccinated against COVID-19. But in Germany and many other democracies, mandatory vaccination programs are still highly controversial. Not so on the Comoro Islands off the southeastern coast of Africa, where President Azali Assoumani has decreed that everyone must get COVID shots.
A military police checkpoint. The cars can't pass without a valid COVID vaccination certificate. The jab against the coronavirus is mandatory for all adults on the Comoros Islands.
So I think we already had a lot of time for sensibilization. So now we are not forcing people, but we just influence them to go and vaccinate.
Critics of President Azali Assoumani call his rule autocratic. He issued the vaccine mandate in December by presidential decree.
If you forgot your vaccination card, you are allowed to ask a friend or family member to bring it here. Then it will be controlled. If you haven't been vaccinated though, or you're late for your second jab, you will have to pay a fine and you will be brought directly to the vaccination center.
In this case, they were brought to the military police hospital around the corner. 58 people were vaccinated the morning we filmed, whether they wanted the jab or not.
Personally, I don't totally trust the vaccines. We shouldn't be forced to get vaccinated. Vaccination should be debated among the general public in the Comoros. We need to consent to be vaccinated and not be forced like this, like animals, like sheep or cows. We're human beings. We have rights.
In the country's biggest hospital, Dr. Ibrahim Jabir defended the strict measures. He is one of the coordinators of the national COVID campaign.
It's a good idea to make vaccination obligatory. People aren't respecting COVID regulations like social distancing. Vaccinating people is the only way we can save lives. And this is proven by the statistics.
Less than 40 COVID patients are currently hospitalized on the Comoros Islands, Dr. Jabir says. None of them are vaccinated. The country is using China's Sinopharm vaccination in its nationwide campaign. Several studies suggest 2 doses of the vaccine are less effective against the Omicron variant. Dr. Jabir rejects the idea.
That's not true. There is proof, so there is no point arguing about it. We had more than 3,000 positive cases around the country during the last wave, with less than 10 deaths.
Back at the checkpoint, the majority of those passing through have had their jabs. It is virtually impossible to do anything on the Comoros Islands otherwise. A COVID vaccination certificate is needed to enter banks, schools and government buildings, and even to take the bus.
And now we check in with DW science journalist Derek Williams. He's been following pandemic developments for us and answering your questions since the onset. This week, Jorge Jonsson wrote to ask, "We're told Omicron is more transmissible but less virulent. Scientists seem to know why it's more contagious. Do they know why it's not as deadly?"
Okay, I read into this until my eyeballs felt raw, and it's complicated. As you say, there are two takeaways that have been trumpeted about the Omicron variant by experts and press alike. The first is that it's more transmissible. The second is that it causes less severe disease. Now, the more transmissible part of the equation is easy to explain. Pretty much everyone agrees that all other factors being equal, a variant that's better at spreading than others will eventually replace them, just as Alpha replaced the ancestral version of the virus, or as Delta replaced Alpha, and as Omicron has been replacing Delta. Expert opinions differ, however, on whether decreasing virulence is inevitable. In other words, plenty of scientists say that Omicron wasn't destined to be less severe than Delta. It just fortunately is. And there are a lot of hypotheses out there for why. One involves what cells Omicron infects exactly and how it infects them. Several studies in animal models, for example, indicate that although the variant is great at infecting cells in the upper respiratory tract massively and quickly, it seems to be worse at infecting lung cells. Now, if that's true, so the theory, then it would make it less deadly because earlier variants frequently migrated to the lungs and caused pneumonia or a deadly out-of-control immune response, which is a real killer, especially among the elderly. But a whole lot of scientists increasingly think that the biggest reason Omicron is causing fewer severe cases proportionally has less to do with it and more to do with us. In epidemiological terms, humanity is in a very different place than it was at the beginning of the pandemic. Back then, the virus had free reign. No one had it yet. Over 2 years on, hundreds of millions of people have had the disease worldwide, and billions of us have been vaccinated. That adds up to a whole lot of immunity, even if Omicron gets around it in many cases. In fact, the variant's ability to infect even the vaccinated and the recovered, some experts say, is contributing to the idea that it causes milder disease. Because it's infecting a lot more people, but a lot more of them have at least some protection. I told you this was complicated. So in a nutshell, what we're seeing now, high transmission, huge numbers of cases, but proportionally a lot fewer hospitalizations and deaths, that doesn't necessarily mean that Omicron is a whole lot milder. A word that authorities warn really sends the wrong message. Omicron COVID is still potentially a deadly disease. It's just that it's a lot less so if you're vaccinated or recovered, as so many of us now are.
But even if the coronavirus does degenerate into something no more severe than a cold, the pandemic has left a trail of devastation in its wake. Besides the deaths, long COVID and economic damage, many are suffering from depression and psychoses brought on by social isolation, especially young people.
It's especially around people that Henning Rösner feels his anxieties. A pressure to please everyone, to fit in, to belong. Since the age of 15, he occasionally had problems in groups. But last summer, he suffered his first severe panic attack. I had the feeling I was about to throw up. I felt sick, I was shivering, and I was cold. In my case, I was lying in bed and I could not move. I couldn't get any rest. It feels like you're not yourself anymore because you are simply overwhelmed. The 21-year-old had spent a lot of time at home in the months before. The pandemic didn't seem so bad at first. No meetings, no university. The social pressure decreased. But then he suddenly felt much worse than before. I think it was because there were so few social events that when things started opening up again last summer, it was much harder for me to integrate again. I think that's why my anxieties were suddenly much worse than before. Just like Henning, many young people spent a lot of time at home during the pandemic, while scrolling through a seemingly perfect social media world. This isolation has consequences. The number of young people with symptoms of depression has increased significantly in Germany. Henning finally decided to get help. This feeling of helplessness, I didn't want it anymore. I wanted to be able to sleep again, and I just wanted to feel better mentally. So I went to see our family doctor. Henning has since started therapy and talks openly with others about his mental health issues. It's amazing when you start talking to people about it, then you come across similar problems. They suddenly start talking about their issues too. That made me feel better because you realize that you're not alone. Falling into a depression, that can happen to the happiest person in the world. Henning has learned from the pandemic. When it's over, he wants to be able to enjoy his life with lots of people around him. For that, he continues his therapy every week.
To round off this week's COVID-19 special, we return to South Africa. We've already heard about the mass unemployment there caused by the pandemic, but a lot of people aren't giving up. Like one man in Johannesburg who's cooked up a rather tasty job for himself.
From a distance, it looks like a normal van, but this is a mobile beggar kitchen made, operated and owned by Tiane Maluleke under the name GrabWorks. He drives to homes and gatherings selling hot burgers and chips, which he makes at the back of his van. But Maluleke never used to hustle like this. He was once a successful mechanic and made a decent income from it until COVID struck and left him jobless. This house in the middle-income suburb of Randburg was once his family home. That's made him resourceful.
It's very emotional for me to be standing here, because I could have been driving out of this yard right now as it is. But in the manner that things happen and in the manner that the house, we lost it, it's very tough. I'm trying my best to get back to, the standard way we were back then.
He went to this car scrapyard, dug up an old Volkswagen car shell, and over months made it move again. Now is his pride, a mobile beggar truck. And his beggars are popular.
It's a raw chicken, pure chicken. He cuts it while you're watching. He takes fresh chips while you're watching, not the chips that were boiled last week and kept. And the sauces, he makes his own sauces.
I trust his cooking, so his burgers are amazing. The wings are amazing. I say try it and you'll definitely love it.
According to economists, COVID-19 has contributed significantly to South Africa's unemployment rate, which has now hit a record high of over 34%.
A double bind of mass unemployment, and yet the sector that is working is not working well enough to grow. COVID's exacerbated that, but as we move out of the pandemic period into the endemic endgame, it's looking like a lot of those jobs that we lost are not coming back.
But Maluleke says giving up is not an option.
My vision is having a chain of food trucks, you know, instead of the whole restaurant, and you know, because people can also buy into the business, you know. It's easier than getting a place to rent.
His dream is to one day own a fleet of these mobile beggar trucks, recruit youth to drive them, and sell the beggars so that he and his family can live a better life again.
That wraps up DW's COVID-19 special for this week. Do join us again next time. Until then, take care and stay safe.